There you go. There's the background music, people. Something different.
Good.
Something different this time. I normally talk with mountain bike and band people and BMX guys. Today I have Dr. Chris Girling from Noah's Crossing Vet Clinic. Welcome to my podcast.
Yeah, thanks for having us.
So I start with the first question for everyone, and maybe it's appropriate here. I ask everyone, if you could be an animal, what sort of animal would you be and why?
Always a dog. I think they're so loyal and affectionate and naughty and mischievous at the same time.
Brilliant. Now, I might let you do a little introduction on your background and what you're doing, and then we'll go into a conversation from there.
Yeah, we started breeding dogs back in 94, 95 with bull mastiffs. My wife and I vet. Graduated vet school 96 and moved to Port Lincoln, which was our first job. Yvette struggled to find work there, so we headed overseas, worked in the UK for 3 years. Always had a love for Dog de Bordeaux, so we accumulated a number of dogs and they came back and formed the foundation of our breeding kennel. So we've had the breed nearly 30 years now. Came back to a job in Port Lincoln and then did locums before eventually opening Noah's Crossing Vet Clinic, which was at our home out at Lewiston in 2003. Eventually moved out of the house and into a purpose-built clinic at the front of our block in 2005. And then our main Lewiston's specifically for keeping large numbers of dogs and horses, so it's a breeding area, and that formed the foundation of a lot of our work in the vet clinic. And again, because we've got a couple of rare breeds with Bracco Italiano and the Dog de Bordeaux, most of the genetics are imported, so we had to become very good at reproductive work and frozen semen work in particular.
Because Noah's Crossing is it the only specific vet that does breeding here in South Australia, or
no? There's a number of other clinics. I suppose we've been doing reproductive work for since about 99, so we've got extensive experience and done multiple training overseas, particularly in the US. Doing a lot of transcervical work now, which is eventually going to become the main regulations that we'll be focused on. They'll probably rule out surgical inseminations in the near future. So particularly when using frozen semen, it's got to be an intrauterine insemination. And there's two ways of doing that, either with a camera to the cervix and pass a catheter through the cervix into the uterus, or surgically where we expose the uterus like we were doing a desexing and put the semen directly in the uterus.
So it's quite a complex experience and exercise.
Yeah, the transcervical work in particular, it's quite a steep learning curve, and we pushed pretty hard. We did a lot of transcervical work between 2004 and 2008, but just couldn't get people to continue doing it. More so that reasons I don't know, but now legislation's looking at coming in. I think that's probably going to be the only choice.
Does that take a new skill set to form that operation, or
we've had to? We've trained a couple of the vets that have become quite proficient in doing it, and so we're now using an endoscope, a rigid endoscope, to do a number of inseminations now.
Because from my experience, I'm a first-time breeder. I took my dog, my American Staffy, out to Noah's Crossing there, and It was definitely an experience. Some highs and lows in there, but I was blown away by the technicality and the timing and everything that's involved. The dogs don't just fall pregnant like you just maybe assume. Some people assume.
No, so we've got to do particular hormone assays. So we run progesterone tests until we can figure out when they've ovulated. And then generally, dogs don't ovulate fertile eggs, so it takes a couple of days for those eggs to ripen. So we need to wait that period before we look at inseminating.
Yeah, because I was heading out to you guys. There was a daily progesterone check where they'd take a blood from the dog and they'd see the levels there. Can you explain a little bit about how that works and where the timing is critical?
Yeah, so initially it might only be every 3-4 days we're doing blood tests, but as we get close to ovulation, it's generally daily blood tests until we can pick the rise in the progesterones and that they continue to rise. And so generally look on our machine, we're generally around 100 to 130 nanomole is when we're inseminating. And I suppose this is where things become a little bit difficult because a lot of people travel to us, but some want to do their progesterones locally, and every machine gives different readings. Although they're in the same units, it can be quite complicated trying to figure out how to correlate the different machines.
And there's only a small window when the dogs can actually become pregnant. Is that right?
Yeah, that's correct. So when we say a small window, generally if we're using fresh semen or if there's natural matings, some of those dogs will fall pregnant even if they're bred out of time. So generally 5 to 7 days the semen will live in the bitch. But when we're using frozen semen, generally it's only going to live in there for 6 to 12 hours. So our timing when we're using frozen semen's got to be really accurate, which is why we do the progesterone testing to figure that out.
And then the timings with, again, as I found out, the time from when the dog falls pregnant to when the pups are on, it's pretty strict kind of dates there. It's pretty accurate with the timing, yeah?
Yeah, so generally 61 to 63 days from insemination, and that's generally a couple of days after ovulation. If people are wanting to do elective cesareans, again, progesterone testing is what we use to figure out when they're due. And when we get a drop in progesterone, generally those bitches will whelp in the next 12 to 24 hours. So that's when we'll take them out if it's an elective cesarean.
And why would people choose cesareans over natural birthing?
Some breeds don't naturally whelp. So, those sort of breeds, particularly pugs, French bulldogs, British bulldogs, not a lot of those are let to whelp naturally because the puppies get stuck.
Okay, just because of the body shape of the animals.
Body shape and size, and they get tired, and so a lot of people will elect to do elective cesareans. So in those sort of cases, what happens is they'll do their progesterone test daily, and when we see that drop in progesterone, we'll take them out. If we just pick a day like 61 days to take them out, there's a much increased risk of mismothering. So some of those bitches don't bond to their puppies. Some, believe it or not, eat their litter. Yeah, so that's why we do the progesterone. So we make sure we get them out at a safe period.
Is that because they don't recognise that they gave birth to that animal, or why is this animal, why is this little thing here?
Yeah, it is. And no matter how often we'll warn people, like you've got to sit with them for the first 12 to 24 hours, even if you go out and have a coffee, pop the bitch in a crate while you go out and do things, because they come back in and unfortunate things have happened. So it's rare it happens because we do the progesterone testing.
Because I found there was an experience with my girl, and she was really squeezing the pup. Like a couple of days in, we had 6 pups. There was 7 there. The 7th sadly didn't survive. We went back to the clinic there, and I think you gave the oxytocin to help.
The contractions and get the puppy out.
So we had that, and that 7th pup, and that was sadly had a cleft plate and hadn't formed.
Yep.
We did the x-rays in the lead-up process, and even those x-rays indicated, oh, look, there's 6 puppies here and there's a small one here, or there's another skeleton. We couldn't quite tell.
Yep.
Is that fairly common that often there's one pup in the litter that's a little smaller than the others, or?
Well, it can do because, again, when we're talking about ovulation and the eggs take a few days to ripen, also dogs may ovulate over 24, 48 hours. So there could be a varying age group within there. So, that's why you'll get variation in sizes of the pups within the litter.
Because I ended up, a lot of information I found was on YouTube, on the internet.
Yeah.
I was doing a lot of researching, and there's a lot of conflicting information out there.
Yeah.
And they were kind of saying, a pup should be born about every hour. There was a couple of hours between some of my pups, and the last one was kind of 4 or 5 hours between. Is it something that pup could continue to grow, and had we not tried to deliver that pup, it needed to grow for 2 more days, or it's not how it works?
No, it's not really how it works. I mean, once they go into labour, generally everything will be whelped and born. When you were talking about numbers and x-rays and so forth, so I suppose for people listening, and that gestation period from when we inseminate, we can generally ultrasound accurately from about day 24 post-insemination, but it's never spot on with numbers. So when people are going to whelp at home, to give them an idea of more accurate numbers, as you did, we'd do an x-ray in that week before they're due and count skeletons, and it's unless it's an exceptionally large litter, it's far more accurate. And so those people whelping at home will know if
Is
all
there
the
another
puppies
one?
are out,
Yeah.
is there another one? Do I need to get to the vet? So, and how urgent it is when there is a big gap between puppies.
What are some of the consequences from not understand? I mean, is this new for serious breeders? I'm assuming they're going to all that effort, but there's a lot of people at home that, I don't know, their dogs have fallen pregnant accidentally,
Yep.
and you really don't know what you're getting yourself in for.
No, and again, in your first litter, it's a pretty steep learning curve. Even little things like, the pups need to stay warm, even during summer. Sometimes you can get cool nights where temperatures drop. So generally puppies need to be at sort of 28 to 30 degrees in those first couple of days.
So they don't regulate their own body heat for about 10 days or 14 days or so?
About 10 days. So so their only warmth is from their mother, and if it's a cold environment, they get a chill. Their body temperature drops and it doesn't come back up, and they're more prone to infections and ill thrift and viral, particularly herpes.
We had, again, first-time breeder, I think I scored a lot of problems, which, again, maybe I did the wrong things. What's best practices to ensure everything goes well? You obviously experienced this. What's some good best practices?
Yeah, look, we've bred quite a few litters, so particularly a whelping box, and having it in a quiet area that they're not going to get disturbed. We use a lot of non-slip bedding, so the vet bed will be absorbent, but the bitch can't dig it up because it's non-stick, and so puppies don't get stuck under the bedding. Having that a heat lamp over an area of the whelping box, such that if the puppies are cool, they'll crawl under the light. And then again, the secret with that is not to get it too hot within the room. So some people will heat the room to that 28 to 30, but it's too hot for the bitch, and then the bitch doesn't want to be in with the puppies. So it's more ideal to have the room sort of 22, 23 degrees and have a warmer area over the corner of the whelping box with a heat lamp. The heat lamps tend to be more proficient than using a heat mat because we've still got that colder air above.
Yeah, I went the heat mat in our example. We were here in this room with the air conditioned, so we were pretty temperature controlled for a while there.
Yep.
But one of the other issues that we had was mastitis. That was a pretty horrible ordeal. My dog, she actually got it twice. What is mastitis? What's from your explanation?
So mastitis if it's an infection, it's related to bacteria going up the duct and into the mammary gland, but can also be spread by the bloodstream into those mammary tissue. Can be particularly nasty where we get necrosis and abscessation of those teats. And I suppose best practice is daily changing of bedding. So we've got clean bedding. Pups can get particularly messy with more so when they're older than in those first week or so when mum's cleaning them up so well. But reducing any source of fecal matter and clean bedding is probably your most important.
Because I had a heap of beds and mattresses, and I was laundry 6 times a day to try and wash it. But afterwards, I'm thinking, there was a number of things. My dog, she was climbing out of the whelping box. Maybe she was dragging herself over the edge of the door frame. I had a little frame section there. She was running around in the backyard a little bit.
Mastitis is difficult because I don't think there's any sort of set rhyme or reason why it happens. You can have the cleanest practices and you can put in every effort, but it still happens. So it's a difficult one.
Is it common in first litters, or is it like if your bitch has been through a few litters, does things improve? Or is it more that the responsible owner, is doing things better?
Yeah, that's difficult.
Have you had much experience with mastitis yourself?
Yeah, look, we've had a couple of nasty mastitises, and generally they're treated with antibiotics and heat packs and sort of milking out those teats. But some aren't responsive to certain antibiotics, which we can leave the puppies on, and they need to go on a strong antibiotic, and then the puppy's got to be weaned. So that can be really difficult when the pups are 1 or 2 weeks old and they're being hand-fed. And that's another level of care, required by the owner, because if you've got a large litter of 10 or 12 puppies and you're hand-feeding everything every 2 hours, by the time you get through, you're starting again.
Yeah.
So that's really difficult.
And mastitis itself, it seems to happen really quickly. I was keeping a close eye, and I think it was literally the first or second day I noticed, look, the teats were getting hard and firm, went back to you guys, and we had the appropriate medication.
Yep.
But it happens really fast, yeah?
Yeah, and it can certainly be localised in one particular teat, which, and sometimes it's just an engorgement of all the teats. So sometimes more prevalent feeding and emptying those teats more often is helpful.
And that's by rotating the pups and making sure that they're draining each of the teats.
Yep.
Which again, a lot of time and effort. It doesn't just happen, you know.
No, I think breeding is particularly difficult, and it's very time consuming if you do it really well.
Yeah, I was pretty much 24/7. I think I stopped everything else for about 5 weeks. Things kind of went okay. All the information I was reading was, if you get to day 3, that's like a critical milestone. Get to day 10, another critical milestone, and then the 3-week period.
Yeah.
In my experience, day 3, we had mastitis. We were able to treat it with good medication.
Yep.
I kept the pups off those teats because people said, again, you don't want the pups drinking that milk because that can cause problems as well.
Yeah, you can get diarrhea issues and, the pup's not feeling so well and tummy aches. So, and then you're then massaging bellies, and there's a variety of things that can be done to try and help the puppies. But, yeah.
Then I got to the 3-week period, and that's where we identified mastitis had come back a second time.
Which I suppose is a better period to get it, because you can start weaning puppies and get them onto soak solids and start that weaning process so it's not as intensive hand feeding.
Yeah, because I went and bought every nipple and every bottle, and people said you've just got to persist and get the dogs to feed the bottle, and you've just got to get them to take it, and weighing them twice daily. But for a day or so, I really couldn't get the pup. They were getting like 30 mils. They should have been getting 300.
Yep.
And to try and get them, they just wouldn't put the teat in their mouth. It was pretty scary for a little bit there. In the end, I found I was just pouring. They were sucking the little corners of my arms. So I was thinking they're just looking for a little space like that to grab. So I was just pouring the milk literally into the palm of my hand, and they weren't sucking the bottle, but they were lapping it out of my hand, which I was very relieved once I found a way. But that was 20 minutes per pup. We had 6 pups, because it's a very slow process to try and feed them like that.
Yeah, I suppose by that sort of period, they will start to eat. So we'll normally start them off with some fresh human grade mints, And as long as you get a little bit in their mouth and they get the taste for it, they tend to continue. But then boiled, soaked dry food and mixing in some milk formula will generally get them going, and that sort of takes a bit of stress off you guys.
Yeah. Yeah, I was blending the kibble to like a fine powder and putting the milk in there.
Yep.
Again, finding stuff online, seeing how people have done it. A bit thick this time, and needs to be a bit runnier.
Yep.
Get that temperature right as well. Yeah, it's definitely pretty tricky. And again, I had a conflicting information from, I was calling the breeder where we initially purchased our animals from, and then speaking to the vets as well about what you're feeding the pups. What is like that weaning period, which is kind of 3 weeks when they start having some solids. What's good and what's bad?
Well, Royal Canin do a number of puppy starter mousses and things like that. So they're, from a commercial point of view, they're good. As I said, I mean, ourselves, we tend to use one of the milk formulas, the puppy milk formulas.
Is that the Wombaroo?
Yeah, Wombaroo we tend to use, and boiling water and soak the puppy kibble. So we just generally use what we're going to wean them onto. And then you can add the milk and get it into something more of a liquid that they're going to start lapping at. And initially, as I said, to start them, we just get a little bit of mince in their mouth, and once they're chewing on it and get the taste for it, they tend to get onto solids.
Raw mince?
Yeah, raw mince. Yeah,
like chicken mince or
no? Probably beef mince.
Okay,
human grade, really fresh.
Okay, because again, our breeder suggested chicken mince, and the vet said, raw chicken's really not great for dog, which makes complete sense to me.
Yeah, some dogs are particularly sensitive to it. So, and certainly in babies, we wouldn't use raw chicken.
Boiling it a little bit, is that okay?
Well, if it was, say, human grade chicken mince, well, then, yeah, you could cook it.
Just a bit of a mix with their... But ultimately what the vets, the dry kibble has got all the right stuff. Yeah. And so what's been your experience when it comes time to let the puppies go? How do you go with that?
Yeah, well, it's really talking to new owners and seeing what sort of homes they're going to go to, and making sure yards are suitable, and getting a feeling for those people where they're going to go. So, and look, a lot of our puppies go interstate, so having a look at the people's properties is a little bit more difficult, but having a good chat to them on the phone and seeing what their experience with certain breeds is another important point.
And you want to check that the person that's taking your breed has some knowledge or experience of what it's going to be like, rather than it's just a dog. No, there's 100 different temperaments and different relationships that they have.
Yeah, absolutely. And even people which, come and visit and so forth, sometimes it's not judging those people. One of our mentors, or where we first had Dog de Bordeaux in the UK, his name was Alan Bates, and he sort of said to me one day that you can have people turn up which, they might be bikies covered in tattoos, but they will absolutely love that dog and it'll be their world and it'll go everywhere with them. And you'll have people, a family turn up in Mercedes and you think that's a great home, but that dog will sit in the backyard and never get touched. So it's sort of getting that, having a really good chat and
asking those questions
and where the dog's going to live. And, say for our breed, they don't do particularly well in the hot weather. So is the dog going to be indoors? Is it going to be air conditioned? And are they kids? And seeing how the kids are interacting with the puppies.
How about how attached do you get to the puppies? How do you go with that?
Yeah, well, I think sometimes by the time they get to sort of 8 weeks, you're ready for them to go.
Yeah.
The first few litters, I think you get more attached to certain ones, but I think if they're going to a good home and you're pretty happy for them to go at that point.
Yeah. There's a lot of mouths to feed because it's not expensive. Again, the Wombaroo, I think I was getting a $50 packet and it was like a couple of kilos. It was lasting me a couple of days.
Yeah, I think it's more the cleaning up that you're doing afterwards that you're ready for them to go.
So tell us a little bit more about the practice there. Noah's Crossing, you're out at Lewiston.
Yes, so we do, our other main focus of interest is rehabilitation. So we've got a purpose-built heated pool with ramps for rehabilitation of animals. So we do a lot of orthopedics from a lot of knee surgeries and platings. So all those will go through recovery sessions in the pool. So I suppose in the past, dogs had surgery and it's like, good luck, we've fixed your knee and it should be fine. But now it's sort of getting those rehabilitated, so to try and reduce the risk of further injury or getting them back to normal form and function.
And that comes, again, assuming a fair cost. Through our process with the last pup, we were warned, look, there could be another surgeries. We might have to do a cesarean, things like that.
Yep.
A local vet here in the city versus travelling to you guys, emergency vet after hours services. You guys have a 24-hour after hours service?
We do an after hours service for our clients which subscribe to our after hours. So we'll be there for them 24/7, and that's peace of mind, and particularly with our breeding clients, because even if you end up at an emergency centre, it doesn't mean a caesarean is going to happen straight away. Sometimes you might be waiting 4 or 5 hours for that caesarean, which can be critical in the survival of those pups. So that's one of our services. And again, I suppose going back to the rehabilitation, the other facilities we have there are underwater treadmill. The girls do acupuncture. We do red light laser therapy, shockwave therapy. So all methods to help your pets recover. But the pool's not only used for rehabilitation, it's used for things like geriatric swims and weight loss swims to try and maintain form and fitness. So particularly those geriatrics where they're having mobility issues, that weightless swimming is a form of exercise, and that's particularly useful.
Is that facility unique in South Australia?
Yeah, there's no other purpose-built facility, particularly for rehabilitation and swimming. The other pools which are available, which I think there might only be 1 or 2 now, they're not ramps, so we can't just walk those animals in. It's quite a process to get them into the pool and get them out.
And how did that? How did your facility expand over the years? I'm sure you didn't start with a rehabilitation pool.
No,
or did you?
Well, we down the front of the clinic, we started in 2005 when we moved down to the front, and it was a 12 by 10 metre building, which expanded with a second 12 by 10 metre building in 2008, and then in 2016 it doubled in size again, and it's when we built the pool at that point. So it's about 600 square metres under roof now.
And you could just see the opportunity to create this environment, because you could see people with animals that were struggling and they're coming to with this problem, and there was no other way of solving it.
Well, that's right. In terms of the rehabilitation, there just weren't those facilities to be able to help those animals recover. And I suppose now there's starting to be more animal physios, chiropractors. So those sort of facilities are developing. But I suppose we've got all the right tools and the right people in place to help people with those recoveries.
Is breeding more popular now than what it used to be, or have you seen let's go back 20 years? I mean, you've been there through that phase as well.
Yeah.
Have you seen changes is it an industry?
It was pretty steady up until COVID, and then sort of everyone bred during COVID. So it's probably just slowing down a little bit now post-COVID. But I suppose everyone bought a dog or a cat during COVID. So that was when we had, I suppose, the most intensive breeding, but settling a little bit now. And that's, I suppose, demand for puppies has gone down.
And do you breed pretty much all ranges of dogs?
Yeah, all breeds of dogs. Yeah, it's probably a few I can't remember breeding, but yeah, generally all breeds of dogs.
Everything.
Yeah.
Are there any that are easier or particularly more difficult than others?
Not really. I mean, I suppose up until more recently, where a lot of procedures were happening surgically, any breeds could be done. Now we're going to train cervically. I suppose each of those breeds have their idiosyncrasies where being smaller or shorter or longer, but they will get done one way or the other.
And you identify all those different animals and different sizes and shapes, they'll kind of go through the same process.
They all go through exactly the same process. So, again, we need to determine when they ovulate and when the best time is to inseminate.
For you in particular, do you do natural breeding or insemination?
We do some natural breeding, but again, a lot of the semen we use is either imported or old frozen semen. So probably moving everything to transcervical insemination now.
And how many litters would your bitch have? Like if you've got a dog that's, or a bitch, my term's
Yep.
probably incorrect. Dog is the boy dog, is that right?
Yeah, yeah, dog and a bitch.
Yeah.
So generally, look, most responsible breeders 2 or 3 litters from their bitch. Some don't even get bred until they're older, so they may only have 1 litter.
And what's a responsible age to breed a dog?
Yeah, I suppose once they've had their appropriate health testing. So if we look at our breed, the Dog de Bordeaux, they've got to be able to have their hip and elbows x-rayed and ideally heart certification, which again is another struggle in SA without a heart specialist in South Australia. But so generally 18 months to 2 years of age, we'd look at breeding. And again, if you intend to have a couple of litters from your bitch and sometimes rehome those because breeders can't keep everything, and so sometimes breeding early is ideal. Have a couple of litters and then desex and get into a home while they're young. That works quite well.
And what about desexing? What is, you've got a puppy, you've got a little 12-week-old puppy, 8-week-old puppy you've got at home. The breeder doesn't want you to breed. There's limited and mains pedigrees for the breeding process.
Yep.
When is a responsible time? And again, does that vary with different breeds?
Look, varies with different breeds, and it's quite a controversial process because, or topic, I should say, because, I think entire dogs are healthier dogs. So once you desex, they tend to be less active, be overweight, often obese, very difficult to manage their weight. And early desexing, say the 6 months of age or even earlier, some breeders will desex very early, can lead to increases in cancer risks and increases in orthopedic risks, so cruciate disease, because early desexing will result in a taller dog. So again, say with our breed, which is the Dog de Bordeaux, it's low set, heavy, wide. If we desex early, we'll end up with a tall, lanky dog. So it can change the form and function of your breed. And again, those taller dogs will have straighter stifles, be more prone to cruciate disease or orthopedic diseases. So, but again, people don't want to have an entire bitch which is going to come into season and bleed every 6 months if they're going to be in the house and things like that. So, that's a whole different kettle of fish talking about that. So essentially when our puppies go, we do sterilise, so we don't desex. So, the boys have a vasectomy and the girls have a tubal ligation, so they can go to their homes. They can't have accidents, they can't fall pregnant, and it's up to the new owners when the appropriate time is for them to desex. Explain
a little bit more about that for us.
The sterilisation?
I wasn't. I thought you just desex. Like you either got a complete dog or it's desexed, but there's another option. Is that right?
The other option is sterilisation. So again, sometimes, and we've found people lie. So, they'll say, I just want a pet, I don't want to breed and this and that. But, they end up either in puppy farms or being bred repeatedly, and you've got no control over it as a breeder once they go. So the option is to sterilise. So when we sterilise, the males have a vasectomy. So they just get a little incision just in front of the scrotum, and we pop. We take about a 2 millimetre section out of the sperm cord or the spermatic cord. So it's only a really quick procedure. And again, with the girls, we take a little section out of the oviduct so they can't fall pregnant. So I suppose the thing, they're still entire animals, so those males will still get male characteristics and so forth. But again, we can get them through to 12 months or 18 months and then look at desexing at that point if that's what, the new owners discuss with their vets and what's appropriate for them. But again, entire dogs, behaviourally, they're different to a desexed dog. And as I said, I think health risks vary in desexed dogs and entire dogs. So that's a discussion they've got to have with their vet in terms of that. So male dogs, leaving them entire, have an increased risk of testicular cancers, anal tumours, and prostatic disease. So, but the one thing with that is generally these are all resolved with desexing. So, that's something that can be done if and when those sort of things occur, and they may never occur. And in terms of bitches, for every season they have, their risk of mammary cancers increase, and the risks of getting pyometra, which are uterine infections.
And so I've only had bitches.
Yep.
If I wasn't planning on breeding, I've taken a puppy home to the family.
Yep.
What would be generally regarded as a good age to...
Well, I would tend to let them have a season and probably that 12 to 18 month look at desexing.
And that's generally the best outcome for the animal?
Yeah, look, I think so. But again, vets will have differing opinions.
And the boys, again, I have some friends, look, the boys they're too aggressive, they're getting too rowdy. Yep. And that's a comment that I've heard, we're going to get him desexed because he's just getting a bit too boisterous. Is that a common theme?
Yeah, it certainly does happen. But again, with those, what I would tend to suggest to people, if there's specific reasons why they're doing it, well, then there is a chemical castrate. So it's basically an implant, like a microchip goes under the skin, and it'll either last 6 or 12 months, depending on the implant that we use. And then what happens from there, it's a testosterone inhibitor. So testosterone levels go to 0, their testicles shrink, and they lose their male characteristics. So it's a way of desexing without surgery, but you'll get the same behavioural characteristics. So sometimes people will go, well, look, I desexed my dog and it's now an old fat dog and it doesn't want to do anything and I wish I hadn't done it. Well, this is a way of...
That's all right.
After 6 or 12 months, those testicles will grow again. And then they've got the option of either just use the implant because they'd rather not have surgery, or, I was quite happy with the characteristics of that dog, so we can go ahead and have the surgery and have it permanently done.
So there's actually a number of options and a number of reasons why you might go down one path or another.
Yeah.
I found with advertising, with the sale of the dogs, I had to become a registered breeder. That in itself was quite a process.
Yeah, so you've got to be registered with DACO or with Dogs SA, depending on whether they're purebred or part-bred dogs.
Can you explain a little bit more about the breeding process if someone thinks, I'm just going to breed a dog? No, there's a lot of rules and regulations.
Yeah,
Could you go through a bit of that?
So you can't even advertise the dogs without a registration or a DACO registration number. So that's, I suppose, important that people realise that that's probably a source advertising to be able to get puppies to new homes. You can't even do that if you're not registered. So purebred dogs will be registered with Dogs SA. And again, what Zoltan asked earlier was registration. So breeders will have the option of putting them on a limit register for not for breeding, or on a mains register where progeny can be registered for further showing and breeding.
Do you show your dogs?
Yeah, not as often as what we would like at the moment, but yeah, we show, we breed, we judge as well. So I had a knee replacement in July, and before going back to work, we went to France for a couple of weeks. So went to the French National Dog Show. So that was a good experience for us and the kids recently.
Have you shown your dogs? Have you got like prize-winning animals in your?
Yeah, we've had multiple Best in Show winning dogs. So
what does it take to win a Best in Show? What does it?
Well, it's
what
different.
needs to be
It's
right?
different in different breeds, because some breeds will never get looked at because they're not a particularly showy breed. So, and then certain breeds will do much better than others on a consistent basis at the show. So, it really depends on, if you're wanting to win regularly, you need a good dog of particular breeds which do particularly well in the show ring.
And that's got to do with their form, their shape, their colour, as well as them obedience.
Yeah, so each breed has a breed standard, so that's what they're judged on. So you've got to be able to breed as closely to that breed standard as possible. But again, there's interpretation of breed standards, and different people will interpret different things out of a standard. And then judges, again, I suppose, will be looking at, they'll have a bias towards certain features that they like. So it's not clear cut as to when I say clear cut, every judge will find different winners in the same group of dogs.
Is it less about personality and more about looks?
Well, it's looks and movement. Yeah.
Just how they move.
And you need a well trained dog. So it's putting the time into that training as well.
Did you find the shows different in France compared to Australia?
No, not really. I mean, it's much the same. We've shown, and we've taken dogs overseas and shown as well. So,
how do you do that? How do you transport a dog overseas?
Well, they've got to fly out and fly back in. So, and that carries its own risk as well.
Is there a lot of quarantining and all that sort of stuff as well?
Well, now it's 10 days quarantine coming back in from memory. And again, when you import dogs, they've got to go through the appropriate blood tests and quarantine coming back in.
So are you with the dog in that quarantine process, or can you explain a little bit about travelling a dog overseas more than in the state? Yeah.
Yeah, so I suppose we had an unfortunate incident of losing a dog on a flight. It was left on the tarmac in Kuala Lumpur for 4 hours in the stifling heat. So, yeah, we haven't, that was our sort of last experience. So that was difficult, and there's nothing you can do about it either. So we went through a legal process for an extended period, and although we could prove what went wrong, and we had data loggers looking at temperature and humidity recorded every 5 minutes through that dog's flight. Yeah. So I suppose when you're flying overseas, it's picking the particular times of the year that they're going to fly in the cooler weather. But again, that can vary the further you go, because different climates and different times of year. So it might be cool here but hot midway, or hot on the other side.
So you'd want to be really experienced before you start doing things like that.
Yeah.
And even with that experience, it's out of your hands.
Can still go wrong.
Yeah.
And no matter how safe you think something can be, sometimes it's not.
Putting that risk in there.
Yeah. So certain breeds, so brachycephalic breeds, so short-nosed breeds, they introduce a lot of rules and regulations in transporting that, again, with new puppy owners, so brachycephalic breeds, they can't fly till they're 12 weeks, whereas other breeds can fly from 8 weeks of age. And they've got to also have health tests done at the vet so that they can be cleared for flying before they can go at 12 weeks. So breeding those particular breeds, it can be a more extensive process because those puppies can't go to new homes till they're 12 weeks if they're flying interstate, so you've got to hold on to them longer.
Because I actually decided against shipping the pups off as first-time breeder. I thought, no, it's a bit cruel to take this little puppy from its brothers and sisters and mum and put it in a box and ship it off. I kind of made that conscious decision from the start. How does that sit with you? Did that, when you first started breeding, your I suppose your interest or your desire, why did you breed the very first time?
I suppose we weren't, in terms of those puppies flying, I mean, most of our dogs had been imported when we first started because the gene pool in Australia was minimal or next to nothing. So I think we ended up bringing in 7 or 8 dogs initially. So we're pretty used to the dogs flying at that point. So getting them
And they're not too stressed? You don't find that they're anxiety or anything?
Puppies handle flights a lot better than older or adult dogs. So getting them into new homes as babies, your main socialisation period for puppies is 8 to 13 weeks. So if they're flying when they're young, they're sort of things that they learn to deal with, and getting them into those new homes in that early period is important because they can then start to do all the things that they're meant to be doing. So getting lead trained and getting bathed and shampooed and nails cut and get the new owners socialised with them as quickly as possible.
What are some good tips for you're a new family, you've got your puppy, you've chosen your breed, you've brought it back home.
Yep.
What should you be doing in those first 3-4 weeks?
Well, I think anything you want to be able to do with your dog when it's older, you need to do it as much as possible in those first 3-4 weeks. So cutting nails, shampooing, bathing, lead training, although you're not wanting, an 8-week-old puppy, you're not wanting it out in public on a lead because it's not fully vaccinated, but you can always get it on a lead and walk around the backyard and get it used to, particularly nail clipping. Like older dogs trying to cut nails can be a nightmare for vets.
I know mine doesn't really like it.
No, and we always remember when we were in the UK and, people would, the 5-year-old Roddy and can you cut my dog's nails? And, the dog's
60 kilo
trying to half eat you while you're trying to cut its nails, and the owner going, yeah, good boy, good boy. It's like, your dog's not a good boy. It's trying to eat me. Yeah.
So that's pretty scary as well sometimes. I mean, my girl, she wasn't that happy going to the vet after a few of those progesterone tests. The last couple, she really was a bit over it.
Yeah. And, that's unfortunately part of the process. And I suppose they do get used to it.
Yeah, just a little bit more on a new puppy. Like what should and shouldn't you do from to that 8 to 12 week period when you're allowed to bring your dog home, but you shouldn't be taking it to public places. Don't take it to the pet shop and get a new collar and lead just yet. What's some tips and advice?
Yeah, so a week after their final vaccination, so generally, say the clinic will vaccinate at 7 and 10 weeks. There's 2 brands of vaccines that we tend to use on a regular basis. They're both licensed for a 10-week finish, which means that 11 weeks those puppies can be out socialising, and that's really important. So I suppose checking with your vet what sort of vaccine they use and if they're using the early finish vaccine. So as I said, that main socialisation period is 8 to 13 weeks, and if you're waiting to a 12-week vaccine, then another week to get them out, that's 13 weeks. You've sort of missed that opportunity to imprint and that learning process for the puppy. So getting them early vaccination so they can be out socialising is important. Puppy preschool, so a lot of clinics will do puppy preschool from about 8 weeks of age, so that's in a sort of safe environment with other vaccinated puppies, so that socialisation can happen.
So kind of just quite aggressive like that, and because the body.
So I suppose there's some of the main ones, and people just got to be conscious, and even when they are vaccinated and getting out, just avoiding those areas where, most of the diseases are spread through the fecal route. So, when I would be socialising, I'd be typically lead training, go and sit at a cafe, sit out there, let everyone sort of come up and it's a cute puppy and get pats, and it's that socialisation with people and other puppies. And I suppose the other most important thing would be only socialise with puppy-friendly dogs initially, because you're not wanting them to get that bad experience being grabbed by an older dog or getting frightened.
So it's not necessarily going to a public dog park. In that early week, it's best to go to a quiet park or walk around the block or things like that.
Walk around the block or just go and sit somewhere. As I said, cafes are great. So if you can go and sit outside at the cafe, and there'll be that many people and kids will just come up and pat the puppy and want to talk to the puppy. So that's a really good experience for them.
Speaking of experiences, this year we've got this algae bloom happening here. What's your advice to people walking their dogs on the beach? I used to love taking my dog to the beach every summer. What are your thoughts on that for this year?
I mean, I would probably just have them on a lead at the beach, because you're just not wanting them to get, picking up dead fish or dead animals on the beach. I suppose that will pose a risk. I haven't had a lot to do with going down the beach, but I would think they're probably your main risks, is you're not wanting them, if there's been dead fish or other dead animals washed up on the beach, you're just not wanting them into that.
At any time of year, I suppose. You don't want them eating. I know Staffys
suppose
like eating lizards and anything they can find. If there's a dead possum in the street, I don't know.
Yeah.
Dog de Bordeaux are what their appetite's
they'll get into
like.
anything too. Yeah, but I suppose the main thing we're seeing with that algal bloom is the wash up of the dead fish and so forth, which I suppose you just want to limit exposure to that, and keeping on the lead down the beach would be ideal.
What made you get into dog breeding? Why did you decide to become a breeder?
Well, generally my wife was her main interest. Her first dog was a bull mastiff, which while we were at uni we went through that breeding process, which was our first litter. And I suppose she had a passion for the dog de Bordeaux, so we sort of went into that when we were overseas, and coming back to Australia with a limited gene pool, we were sort of forced down the path of using frozen semen. So that sort of took a professional direction. And again, because we came back to Australia with numerous dogs, the only place we could really live was out at Lewiston, which is the area where most of the breeders are.
How many animals have you got now? How many? Well, dogs.
Dogs.
So, you say you
we
got
probably
horses
have
as well?
about 15 dogs.
How do you home and house and look after 15 dogs?
Yeah, so I suppose having good facilities makes it the process a lot easier. So generally sealed floors in the kennels, and we've got numerous dogs inside, and but you can't have them all inside. So
You don't have 15 dogs watching TV with you at night?
no, definitely not. So kennels, again, sealed concrete floors, air conditioning for the kennels, good areas for them to get out and exercise, and access indoors and outdoors at all times.
So are your animals pets, or do they sit on the lounge and watch TV with you, or do you have a favourite?
Well, look, we've got 5 or 6, I suppose, that house dogs and in and out, but we also have kennel dogs as well, which are part of the breeding program.
And a lot of poos to pick up. 15 dogs.
Yeah.
You got full-time cleaner there.
Yeah, kids.
Kids. Getting used to
So
that.
that's their pocket buddy.
Yeah. Okay.
So yeah, they our oldest lad, he's 12, Hunter. His pocket money is feeding the dogs and picking up and making sure they got water bowls, and he does that pretty religiously. So.
And how often would you breed in a year?
Oh, look, we probably breed 3 litters a year, sometimes 4.
How many pups do the dog Bordeaux normally? Do they have a certain size litter? Certain dogs have certain numbers?
Yeah, they can have very large litters. I've had a litter of 18, so it can, and that's, yeah. another form of torture
Yeah.
if you have complications or issues and having to look after hand rear, that sort of number. So that can be difficult. But, sometimes they're small litters as well, which sometimes, we're never unhappy with a small litter.
A bit more manageable, I assume. And we 6.
Well,
First time that was quite manageable for
we're
me.
all busy people now, so
Yeah. And I know for me it was pretty much 24/7 care.
Yeah.
I mean, we had issues, so I definitely had to up that time limit there. But would you expect that's what, if you're breeding dogs, those first few weeks?
First few weeks is really intensive. And the larger the breed, the more clumsy they are, so they tend to lie on, step on puppies. So again, I suppose one thing with whelping box, little pig rails around the outside of the box, so the puppies, so the bitch can't lie against the side of the whelping box, which tends to be the most common crush point. They get behind the bitch and get squished.
You did mention earlier how the animals, they can eat their pups. They can decide for some reason this is their thought process.
I think it's normally the shock of things. They sort of, puppies are just taken out at the incorrect time and hormones haven't changed, mothering instincts haven't kicked in, and they wake up and got these puppies crawling around and they're just not monitored
they're
properly.
tired and they want to sleep, and I got this little thing annoying and scratching at me.
So normally it's hormone related.
That the bitch has an irregularity, or she's sensed something in the pup.
Well, I think people have elected to take puppies out at the incorrect time and sometimes not listen to appropriate advice.
Because there was, they say, the example I had with my girl, she was grabbing and squeezing the pups. In the first few days, she lost that 7th one.
Yep.
And in my mind, her brain just switched. We had a couple of visitors come in, and I'd weighed the pups, and then she seemed to think, "Oh, look, you've taken my puppy," and she was looking around the room here trying to find a puppy, and she'd got really anxious.
Yep.
And then she's actually picking up some of the pups and really squeezing them. And I was thinking, do I let her just do this, or when do I stop, or what was going to happen there?
Probably more common in that, initial 24, 48 hours that they can be anxious like that, and particularly if they're getting disturbed as well.
And because, again, my girl, she'd pick a couple of the pups and squeeze them. I wasn't sure, look, are they constipated? Like, trying to guess her reasons why she's doing it. And, she'd been a bit rough. Has she been a bit clumsy? Her eyes, she'd go a bit wild, and then she wasn't careful stepping and walking around. It's like she lost her brain for a minute.
Yeah. I think it's just mother instincts more than anything, and anxiety more than anything.
I mean,
there's nothing you can really do apart from keeping things as quiet as possible and maybe some soft music. Sometimes that may help.
Yeah. What's been in the breeding process, what's been a really good experience and what's been a really bad one for you?
I suppose bad one, easy. Our most recent litter, we'd used some really old frozen semen. She had 11 puppies, 7 were born dead, just 4 were born alive, and I think we lost 3 in that first 24 hours. So we've got a single puppy at home who's doing really well, but we hadn't experienced that before. She whelped the puppies really easy, but it's not like there were complications and, they took a long time to come out. They came out really frequently. They were just born dead. So that, I suppose, wasn't an easy situation. I suppose good situations is just when they're born. We're happy when they're just born naturally and nothing's born dead. I think bitches which can whelp naturally tend to mother a lot better. They don't have the pain of the cesarean and the change in environment, as in having to go to the vet, have surgery, get home, get settled,
wake up, get your bearings,
wake up with puppies all over me, and they've gone through that process, so they sort of aware of what's going on.
Yeah, that was in my head when we were going back for the 7th. I thought it might go down this path.
Yep.
I'm just thinking, look, you've got a mother with young pups,
Yep.
and you've just had a surgery. Like, I figure that's got to be, got to be a little bit traumatic for the mum as well as having a wound that you've got to try and take care of.
And again, I suppose being in the car with the pups, and the pups are, say, in a box and they're making a lot of noise and she's not exactly with them, so that can be upsetting as well. Yeah.
And what about in the vet clinic itself? How many staff you got working there? It looks like you got a fairly big operation going on there.
Yeah, so we've got about 35 staff. So 6 or 7 vets, 7 or 8 vets actually. Look, they all have their own special interests, and some are training with their internal medicine specialties. Some are more favoured for surgery. We've got a couple which are really interested in the reproductive now and have done their TCI, transcervical training. And then, those others which are particularly interested in the rehabilitation. So there's a variety of special interest groups, I suppose, that we have at the clinic.
And you're able to sort of direct them. They've got their own little kind of area now to specialise in as the program gets bigger and more advanced.
And look, we're particularly fortunate too. We've got a number of overseas vets which are retraining, so they're going through the process of getting recertified in Australia. So while that's happening, they're nursing. So we've got highly trained nursing staff as well.
And are they breeders as well in your staff, or?
We've got a number of staff which do breed as well. So, they, a few of them are on reception as well. So, they're that go-between with clients and with the clinic, and I suppose have that knowledge to be able to talk to them and what they're going through.
Because again, I found like I signed up. You have an emergency, like an after-hours phone consultation, and I found that invaluable here when I was, had questions. At least had someone to ask. Can you explain a little bit about that service that you offer?
Yeah, and look, we do a emergency service. It's $50 a month, and people have that knowledge that they can talk to us anytime, they can get seen anytime. And sometimes it's just that peace of mind that they can talk to someone about the problem that they've got without having to travel. And, we have clients signed up as far away as Port Augusta, and they might only have one animal, but they want that peace of mind whether or not they have to go to the vet or not. And sometimes, with other emergency services, they might say, well, look, you'll just have to come and take a seat and then we'll have a look, and they won't sort of interact with the client to, get to the bottom of things.
In a timely manner.
So it's a lot of it's for peace of mind, but it also means that you're going to get seen to as soon as possible when you come in.
I'm just thinking again, when I was trying to learn stuff through the breeding process, temperatures, measuring weights, what are some critical key indicators that a breeder should be, or even you're not a breeder, you had an accidental, your dog had an accidental set of puppies.
So some of the simple things are newborn puppies, weighing them twice a day, making sure they're gaining weight is important. Toileting those puppies. So again, some mothers won't clean them particularly well, so they require stimulation from the mother to actually toilet. So that means sometimes you're toileting those puppies with either, generally wet wipes or something like that. Knowing whether or not they're feeding well enough. So when you're toileting those puppies, if the urine's concentrated, they're not feeding enough and they need supplementation. If it's dilute, they're feeding really well. So they're little things that to know whether or not they're doing well. Don't take a lot of temperatures with puppies unless they're, unwell. as long as they're staying warm and under heat lamps or
You can kind of feel their paws and feel their extremities to see how their paws are cold.
and they're happy and active.
Yeah.
I suppose they're probably the main two to be looking at is that you're toileting and the urine's remaining dilute, and then you know they're feeding well enough and you don't have to supplement.
Because they don't actually toilet by themselves. Puppies can't actually, they don't know what to do.
No, they've got to be stimulated. So that's either mum licking them, that's why you'll see them, mum's cleaning them and licking them, and that stimulates them to toilet. But some bitches won't do it.
I can imagine it. I mean,
So
Kai was
it
gagging and stuff like that, yeah.
So it means that you've got to be toileting those puppies after you feed them if you're having to feed them. Yeah, so it's the other thing people need to realise. If you're hand feeding a litter, you've also got to remember to toilet those puppies.
It's a lot of work.
It is a lot of work.
It's not. I mean, I don't know if you've travelled to Bali. There's dogs everywhere in Bali, and there just seems to be. Look, this is just how it happens, and it's easy. But from my experience, there's probably a lot of those dog animals that don't survive.
Yeah, it seems like the more effort you put in, the harder it is, and you'll find accidental matings, and you hear stories of people like, yeah, the dog crawled out from under the house and I had 6 puppies crawl out with it. It's like, it happens. And there's been no stress, and everything happened by itself, and these puppies have appeared. So it does look easy when that's the case.
What's your opinion on, backyard? I mean, obviously, let's call them backyard breeders, accidental birthings, or whether it's deliberate. You haven't gone down the path of becoming a registered breeder. When I was advertising my dogs, I could see a lot of other animals advertised as well, and I was wondering, like, how you're able to advertise your animals if you're not a registered breeder.
My understanding is, like, you're not allowed to advertise them without a DACO number. So that's the Dog and Cat Management, your registration. Accidents do happen. It probably happens less now because the legislation in SA is that everything's got to be desexed by 6 months unless you're a registered breeder. So in the past, when that wasn't the case, there was a lot of accidental matings or a lot of backyard breeding. So I suppose that's tightened up a fair bit.
Because I've, again, had a couple of stories where they found they've just dumped the pups. The bitches had puppies, unwanted puppies, and the owner, for whatever reasons, decided the best way to solve this problem is to put them in a bag and,
I'll put them in a box and leave them on. We've had that with kittens doorstep. Or, they get left on the vet doorstep or, it happens, which is pretty sad.
Yeah, I can imagine. When did you fall in love with pets? Were you growing up? Did you have animals and pets around you?
Yeah, we had, Mum and Dad always had corgis and Burmese cats. So we always had, animals around and an affinity for them. But I think when I left school, I was always going to be a dentist, and got to the end of year 12 and it was like, yeah, no, I can't be a dentist. So I went down the path of veterinary science.
And what was that process like? How long did it take? Where did you do your schooling? Was it here in Adelaide?
University of Queensland. I graduated in 96, so 5-year course up there. Took me a little bit longer than the 5 years for varying reasons, but
couple of Friday nights in the tavern.
Too much Friday night in the tavern, I think. Yeah, but the course started down here in I reckon about 2007, 2008. University of Adelaide out at Roseworthy started a veterinary course. So my wife went through when we first met. University of Queensland, she was doing ag science, but she went back and did the vet degree through Adelaide. So she graduated in 2017 and she's doing horse work, but having a course locally has helped us. It's only sort of 15 minutes from the clinic, so we get a range of students coming through, and we've had a lot of really good graduates through University of Adelaide.
And do you need to keep your training up? Do you need to recertify yourself that you're keeping up with the latest information?
Yeah, the Veterinary Surgeons Board has pretty strict requirements that with continuing education. So, and all our vets go through courses every year. And it depends on their interests as to what sort of courses they want to do. So I tend to do a lot of orthopaedic courses where others have done orthopaedic and dental courses or business management courses. So there's a lot out there now which has been particularly good in the veterinary industry.
How do you put your head into a headspace when an owner's brought an animal in that's struggling or things aren't looking good? How do you...
I suppose it's preparing the owners that, look, things aren't good, so it's not a surprise to them if things don't go well. But also, I suppose, putting the welfare of that animal first and foremost, that one, we're doing the right thing and getting the proper diagnostics and preparing the owner, what sort of costs are involved. So again, that's not a surprise, and keeping them updated on progress and we've got to make sure we keep them up to date with bills and costs involved as well, because finances are hard for everybody at the moment.
And you're faced with a situation where my animal's critically ill, or can I extend its lifespan? I've had a couple of animals. When it comes to later in their life, it's a hard decision for owners to make. Do we spend money trying to extend this life, or there's not much quality of life left?
Yeah, well, I suppose it depends on what their quality of life is at the time and what sort of medical management's been done. So sometimes those dogs aren't very mobile, so they're struggling on their legs, but there's good arthritis drugs and things like the hydrotherapy in the pool helps with their exercise and their maintaining muscle mass, and the arthritis drugs to help with mobility. If that hasn't been done yet, well then, often we may say, well, look, try this for a few weeks and see if we can get them more mobile and happier. And sometimes those dogs, get a new lease of life with appropriate medication and treatment.
How much and what sort of food should we be feeding our animals? Like relative to the size of the animal?
Yeah, so, and again, it depends on their neuter status. So D-sex dogs, generally metabolism's 40% slower, so it's really hard to maintain and or not put weight on in those D-sex dogs. So
explain a little bit, spend a little minute on that, because you go to the dog park. My dog's a little bit overweight at the moment. She's eating the extra puppy food.
Yep.
But you see, Staffys is my breed, and they're like kegs. That's not a healthy dog.
No.
How much should you, and what should you be feeding them?
Well, again, those on a commercial diet, so we're talking generally dry food or dog rolls, like prime dog rolls. Again, I think what they say to feed on packets is often quite excessive. So it's being able to maintain a healthy body weight. So I think it's really putting your hands on the dog on a regular basis and feeling their ribs and feeling their body condition. And if they're starting to put weight on, backing back the food. So I don't think there's a set amount that they should be fed. It's really according to their body condition. Because once they got weight on, it's particularly hard to get it off without, special diets and so forth. So maintaining exercise is, the other key factor. So it's a lot easier in end-tired dogs. Because again, the metabolism isn't slower, they're more active, they want to exercise, whereas a lot of the D-sex dogs don't have that activity levels.
And that's for males and females?
Yeah, males and females, and that's so you'll notice a lot of the neutered dogs or D-sex dogs are in heavy body condition most of the time.
Yeah, I find that. I had no idea that that's a result of desexing. So that's pretty interesting information to say, look, maybe if you have got your dog desexed.
I think one of the biggest longevity studies was done in Rotties over 20 years, and they found that the average life expectancy of entire bitches was 8 years and D-sex bitches was 5 years, and there was a vast increase in bone cancers in the D-sex population. So sometimes just saying, you know, a blanket everything's got to be D-sex isn't necessarily the right thing. And again, I think one of our puppies went locally, and the vet said, look, you've got to D-sex the bitch at 6 months because it's going to get breast cancer. And it's like, you know, we've bred for 25 years and we've had one bitch with mammary cancer. So the risk in our population of getting mammary cancer is very low because it definitely has a familial content. So that blanket D-sex everything doesn't necessarily, you know, you've got to have that conversation with your vet as to what's the best thing for your breed and for your lifestyle.
Is it right to say if you've got a 20 kilo dog, their stomach is the size of your fist? Would you kind of say, you know, if you're putting more than a fistful of food in its belly, then you're giving it too much? Is that a bit of a rule of thumb?
Well, not necessarily, because it depends on their activity levels. So you can have certain breeds, say German Shepherds, and they'll run all day long, and those dogs need a higher quality dry food, higher nutrition, and more often to be able to maintain their body weight. So I think, yeah, it's not one size fits all with those sort of things. It depends on, you know, the activity levels and, what their function is more than anything. And sometimes if they're just a dog that sits in the backyard and does nothing all day, well, then they need to be on a light dry food and minimal amounts.
And otherwise, say you've got a German Shepherd and he walks in the morning, he has a good run in the afternoon. How much would you be feeding an animal like that? How often?
Well, dogs do better on twice daily feeding. It helps with their metabolism than just one big feed. And again, that I suppose brings in another thing. Certain breeds get certain conditions like bloat and gastric torsion, which is life-threatening. So big feeds, you know, may increase that risk as well. So, and again, I think it goes back to putting your hands on that dog every day, and you should be able to feel their ribs easy but not see them when you're looking at them. So, you know, if you're just starting to get that little bit of coverage over the ribs, well, it's backing the food back. So, you know, I would expect a German Shepherd be on 2 to 3 cups of high nutrition dry food morning and night if you were feeding a dry. But it could be a kilo of fresh meat, you know, split twice and a little bit of dry food. So
what's bad? What's bad to feed you? What should you not be feeding your dog?
Well,
how long's the list?
There's certain foods which are toxic to dogs. There's certainly cooked onions and chocolate, and there's a variety of things, but, you know, a common thing, you know, the dog might clean up the scraps from the barbecue, but you got to be careful. The onions have been taken to the side. And I think cooked bones are probably another bad thing. Raw diets are, again, that opens up another can of worms where, you know, some vets will say raw diets are terrible and some encourage it. So raw diets, again, the only dogs we see with really healthy, good teeth are dogs that chew bones. Your veterinary dentist will say, well, you shouldn't be feeding bones because they can get slab fractures on their teeth. And but again, those dogs which aren't having bones tend to be having an anaesthetic and a dental every 12 months. So you got to weigh up, you know, do I want my dog to have an anaesthetic every year because I don't feed bones, or do you want to deal with a possible tooth fracture if and when it happens on an occasional basis?
And that's like a bit of marrowbone from the vet or something like that. Just give them something to chew on in the backyard and they can bury it and play with it for the next 3 weeks.
And again, if you do feed bones, it's important that not multiple dogs in the household. They're going to fight over bones, or, you know, they have it in their crate and they eat their bone, and you take the bones away, because it's certainly a source of fighting if you've got multiple dogs with bones.
You were talking about onions are bad. Why are onions bad?
Affects their kidneys, so they tend to get blood in their urine. So it's toxic. So big no. So
Okay.
I suppose the most common thing we would see is dogs starting to urinate blood, and they'll come in.
Any other bad ones? What you can think of? Yeah.
Chocolate.
Easter egg hunts, keep
Easter
that
eggs.
out,
So
yep.
the darker the chocolate, the more toxic. And sometimes if it's you only need a small amount of dark chocolate, that can be really toxic for dogs.
And you're like literally talking a little piece of an Easter egg, for example.
Again, depends on the size of the dog as well.
Yeah.
So there's, toxic levels by weight according to size of dogs. So it's just important that it's locked up around Easter time.
And chocolate is really bad. Then.
Really bad.
Really bad. And onions. Any other? Are there a few other things that someone wouldn't know?
Grapes and raisins. So they need to be avoided as well.
Again, reason just the chemical makeup of the.
Yep.
It's just bad for them. Too acidic or something.
Grapes and raisin, again, I think it's kidney issues. And the other thing is sometimes they'll get into radiator coolant. So it's if it's leaking around the bottom of the car and so forth, leaking radiator coolant can be an issue as well.
Doesn't sound good. And what about human food? Like we're having dinner, here's the food scraps. How much of my food scraps shouldn't I be giving to my animal?
Yeah. Again, I mean, it goes back to putting your hands on the dog, and it's not an issue if you're feeding scraps, as long as I think the figures is as long as 50% of the diet's made up of a commercial diet, they're getting all the vitamins and minerals they need. So how you make up the rest, isn't overly important.
And not trying to cast shade on any brands of food out there, but dog food isn't dog food. You can read the labels and they can say, it's got all this good stuff and there's a lot of fillers. Are there any brands, are you allowed to say, look, this one here's had some dubious results, or is there anyone that you get people to steer away from something or towards something?
Yeah, so your more expensive foods tend to be real meat as the number one ingredient, whereas your cheaper foods, it tends to be cereal proteins as your number one ingredient. So it's the quality of food is what you're paying for. And I suppose in terms of research in the market, probably Royal Canon's done more research than anybody, so it tends to be the number one brand.
That's what I've used on mine. That's what people suggested was the best one.
And a lot of companies use research from Royal Canon to develop. So that's what we feed. And
so if you are reading the label and you've gone into the pet shop, because it's expensive.
Yep.
Good dog food is expensive.
It is expensive.
And you're going, look, I could probably feed myself and my family for the same cost as the dog. But should you be reading the label and just checking, is there anything on the label that's a big standout for
well,
good
I think
or bad?
if you choose a good brand, I don't think you've got a lot to worry about. But there's a lot of new brands which come onto the market, and I suppose it's checking what generally real meat is the number one ingredient, not. So if you say you've got chicken, you've either got chicken or you've got chicken byproducts, and chicken byproducts is basically everything else that we don't eat.
Okay, all right. There's a good point there. Yeah.
So
because there's so many. You go into the pet shop, there is 100 different brands, all different varieties. Dog food's dog food. Like, no, it's not.
Yeah.
But okay, so there's a good example there. If it says chicken byproducts or beef byproducts, that's how they'd have to label it on the packaging.
Yep. So, and the first ingredient is always the one with the highest concentration in the food.
So the written on the label, it kind of goes in order of importance.
In order of, I think, quantity from memory. So your first ingredient should be real meat, whether it's chicken or beef or salmon or,
We are we're going to come close to wrapping this up. Like I say, I normally talk to mountain biker, BMX and band people.
Yep.
And one of the comments towards the end, I say, if like you've had a bad day, you're having a bad day,
152
put yourself in the shoes of yourself or someone else. When you're having a bad day, for whatever reason, you've had your pups that you've got a bad result, or you've lost an animal on the tarmac, or the life, family. When you're in that hole, what do you do? How do you get out? What do you do on those bad days?
I think it's still remaining positive and be thankful of the things you do have more than anything. And I think we're particularly fortunate with good family and good people that we work with, and I think that's probably the most important thing, is to stay positive. Life is good.
Life is good. Would you like to just, where can people find you? We'd like to just share a little bit of information again. We have mentioned it. But
Yeah, we're out at Noah's Crossing out at Lewiston, 168 Hayman Road, Lewiston. As I said, our main interests are in the reproductive field, but we've got a particular passion for rehabilitation and orthopaedics. So, and as I said, we do provide an after-hours service. So you're not having to wait for hours on end at emergency centres.
And you've got a website, people can find you on social media, or?
Yeah, websites at noahscrossingvetclinic.com.au. You can book online, or you can phone the girls at the clinic on 8524 2260.
Do you have social? You have Facebook or Instagram? Or anything?
Yeah, I think the girls have got Facebook and Instagram, so they post pretty regularly.
I reckon we might call that about a wrap.
Thank you.
Wind up a couple little cheers here and a bit of exit music. Dr. Chris Girling from Noah's Crossing, thank you so much
for
coming and having
really
this conversation with me. I hope more
fantastic.
people learn about what you do and share the good word.
No worries. Thanks very much for having me.
Thank you.
Thank you. Whew.
There we are.
Wasn't as stressful as I thought.